If I shouldn't be alive when the robins come, give the one in the red cravat a memorial crumb. If I couldn't thank you, being fast asleep, you will know I'm trying with my granite lip.
From prehistoric ages, a killer has been at loose, ravaging mankind and taking millions of lives. Evidence of the killer's mark has even been found in Egyptian mummies thousands of years old. The unfortunate saga of deaths still continues till date due to this marauder in the form of a bacteria called Mycobacterium tuberculosis. As per World Health Organization estimates, about 1/3 of the world's population is infected with TB bacteria today. TB is the second biggest killer disease after HIV due to any single infection. In 2013, about 9 million people developed TB disease and 1.5 million died of TB. TB is responsible for 1/4 of HIV-related deaths. Persons with HIV infection are 26 to 31 times more likely to develop TB. 95% of TB death occurs in low and middle-income countries. India, with the world's highest TB incident cases, leads the TB high-burden countries. It has 1/4 of the global TB incident cases, apart from 1/5 of the global MDR TB burden. India also contributes to 31% share of total missed TB cases globally. India, as per WHO estimates for 2013, has TB prevalence, including TB HIV co-infection, 2.6 million. TB incidence rate is 2.1 million. The TB mortality, excluding TB HIV deaths, 240,000. Mortality due to TB HIV co-infection, 38,000. Total TB notification, 14,15,670, which is 9.4 million. Smear positive TB notified, 6,21,726. Smear negative TB notified, 2,92,926. TB relapse notified, 1,02,660. Extrapulmonary TB notified, 2,26,557. German Leprosy and TB Relief Association, or GLRA India, an international service organization, has been implementing Global Fund Round 9 TB project, or Project Aksha, in the state of West Bengal in India since April 2010 as GFATM sub-recipient grantee. The project is being implemented in the 8 districts of Darjeeling, Dakshin Dinajpur, Birbhum, Bardhaman, Purulia, Bankura, East Medinipur, and North 24 Parganas. The principal recipient grantees from civil societies are World Vision India and International Union Against TB and Lung Diseases. The program is being implemented in partnership with the revised National Tuberculosis Control Program, or RNTCP. Identifying the major challenges of TB control program in India, Project Aksha targeted 6 core areas of intervention. TB advocacy, capacity building of healthcare providers, soft skill training of health staff members, promote suspect referrals, TB case detections, dot provision and treatment adherence, supporting vulnerable communities, stigma reduction through sustained TB awareness, sustained TB advocacy at all levels, for the rights of vulnerable TB-affected communities has always been a principal component of the project. Advocacy programs are being conducted at the state, district, sub-district and at village panchayat levels. Over 200 MLAs and MPs have been sensitized by the project at the West Bengal State Legislative Assembly through day-long TB advocacy program.
Directly observe treatment with short course chemotherapy. অর্থাৎ সরাসরি নজরদারি চিকিৎসা করব। আমি ওষুধ দিয়ে ছেড়ে দিলাম বা প্রেসক্রিপশন দিয়ে ছেড়ে দিলাম, সেখানেই যেন আমাদের দায়িত্ব শেষ হলো না।
TB advocacy at all levels, from state to district to village panchayat levels, preceded and sustained all other interventions. Training and capacity building of all care providers in the intervention areas and involving them in TB control activities has been a major focus of the project for GLRA India. Over 5,300 non-qualified rural healthcare providers, or RHCPs, were trained and involved in RNTCP. Training and capacity building were undertaken for other care providers, including NGOs, CBOs, municipal health workers, self-help groups, traditional healers and Ayush, who were involved in TB control activities. Soft skills training of government health workers has been a unique initiative by the project to address gaps between care providers and TB patients with focus on communication skills, team building, time management and conflict resolution through soft skill modules developed by the project, referrals of TB presumptive cases, provision of DOTs through trained community DOT providers, and promoting treatment adherence have been major activities of the project. A significant number of TB presumptive cases were referred by the project and followed up till diagnosis and treatment. As part of promoting treatment adherence, over 2,500 TB defaulters under treatment were traced and brought back to treatment. Over 500 patient-provider meetings were conducted, and over 300 needy and poor TB patients were tagged to social welfare schemes by the project. Vulnerable communities in India, such as tribes, slum population in urban cities, people living with HIV, migrants, and sex workers are especially vulnerable to the TB disease. Project Aksha designed and implemented multifocal interventions for such vulnerable populations, including sensitization programs, TB-HIV coordination meetings, community participation, and involvement of care providers amongst the community members.
আর আপনাদেরও বলছি, কারো যদি 2 সপ্তাহ বেশি কাশি হয়, ঘুষঘুষে জ্বর আসে, সঙ্গে সঙ্গে কাছাকাছি যে স্বাস্থ্য কেন্দ্র আছে সেই স্বাস্থ্য কেন্দ্রে যাবেন।
Study on health-seeking behavior amongst marginalized communities revealed TB stigma as one of the major deterrents for seeking services for TB control. Vigorous community sensitization programs, IEC activities, were undertaken across intervention districts. Over 5,500 meetings with targeted communities and village panchayats were conducted, sensitizing over 121,000 community members. Emphasis was given on basic messages on the disease prevention and control. After successfully completing 2 phases in 5 years, Project Aksha has been extended with effect from October 1, 2015.
পদে আজকের শপথ হোক একজনও যাতে যক্ষ্মা রোগী এই বাংলায় না থাকে।
Incorporating new funding model, or NFM, of Global Fund, which will continue till December 2017. The major focus in present NFM phase of Project Akshaya is on urban TB control with the private sector, particularly targeting 1 million missed TB cases in India. The incentive-based major interventions include active case search through household visits, contact tracing, INH prophylaxis, counseling and nutritional support to MDR TB patients, chest X-ray and CBNAAT support, TB case notification by qualified practitioners, training and involvement of care providers. WHO has declared post-2015 Global End TB Strategy, with the hope gaining momentum for a TB-free world in sight after centuries of fight by mankind against this dreaded killer disease. An appeal resonated beyond communities and countries. A strong and emotional appeal was made to the global congregation at the 45th Union World Conference on Lung Health, Barcelona, where the project has participated.
Stand up now. Stand up and say that it's time to stop TB. Stand up and say, we refuse to be here in 10 years' time, in 20 years' time, and still see such small annual reductions in this disease, which afflicts the poorest and the weakest in society most of all. Stand up and say, it's in our collective power to stop this. If we have the ambition to do better, stand up and call on the people who represent you to act.